Thank you, Dr. Amal, and I would like to thank the organizers for this wonderful meeting, and I'm glad that I am here with you and face-to-face after a long time of being only virtual. This will be my disclosure slide. What I would like to do in the 25 minutes or so is give you some introduction about intermittent fasting, followed by some benefits that we think about in intermittent fasting, and studies. Again, there are many studies, but some studies with intermittent fasting, ending with the summary of the studies in a nice recent review, with ending also by current advices for the people who would like to use it, and the future directions. I'm sure all of us are aware of the global epidemic that we are facing worldwide with regard of obesity as well as diabetes. And you can see from this slide of the world map that we have 650 million individuals living with obesity worldwide. And you can see that our region in the dark color is the highest in the prevalence, more than 30% in our region and the Middle East, some of the countries in the Middle East. Now, not only that, but in the top 20 countries with the highest and overweight and obesity rates, you can see I have highlighted two countries, the countries I'm coming from and Bahrain, and you can see they are in the top 20 in addition to other Gulf countries included here. And this is showing the prevalence of obesity in the Gulf. And you can see that Kuwait represents the highest prevalence with obesity more than 38%, and the lowest is in Oman, 27% of obesity, and other countries are in between, including UAE and Bahrain. As expected, this has been associated with increase of the prevalence of diabetes, and you can see this is from the 2019 International Federation Atlas, showing the statistics that was in 2019, we had 463 million individuals living with diabetes, and this is projected to increase by 2045 to reach 700 million individuals with diabetes. Not only that, if you look at this map, and I highlighted the Middle East and North Africa, you could see here that the second increment in the prevalence would be in our region. You can see that's 96%, only following Africa, which is going to be the highest in the prevalence in the year 2045. Now, with all this, what we heard about obesity and type 2 diabetes and the increasing and the epidemics, people start looking for some way of, talking about how to manage these things, whether it is a diet, physical exercise, lifestyle. And here we come with the idea of intermittent fasting that came to be more popular these days. And for many people, they think it is the easiest way to do because it's less restrictive than the traditional way we advise our patient with caloric restriction generally. Now, the American Diabetes Association in 2019, they discussed intermittent fasting in their nutrition therapy for adults in their consensus report. And that was because there was increased interest. And actually, I was in the meeting and I saw there is no place for us to sit in that room. They have to use a second room because people are interested to attend that topic. So what also said in the report that it is a way of eating that focus more on when you eat and not what you eat. And people, as we all know, been fasting for many reasons. One of them is before going to see the doctor, they start doing some weight reduction, but also more importantly is religious and spiritual practices. Looking at this slide, we can see that fasting is virtually in every major religion in the world. You can see here Hinduism, Buddhism, Judaism, and also Christianity, whether Greek or Catholic Christians. And I would like to say to you Ramadan Mubarak, because in 1 month we will have Ramadan, and you can see that Muslims fast also like the other religions mentioned here. And the fasting in Muslim religion is from sunrise to sunset during the holy month of Ramadan. Not only that, Prophet Muhammad, peace be upon him, also encouraged fasting on Mondays and Thursdays every week. What about historical fasting timelines? Just this is an example of some of them. Hippocrates in 400s before Christ mentioned in his writing that to eat when you are sick is to feed your illness. Plutarch, an ancient Greek writer and historian, wrote, instead of using medicine, better fast today. Later on in the 1400s, Philip Paracelsus, the founder of toxicology, wrote, fasting is the greatest remedy. It's the physician within. And Benjamin Franklin in the US in the 1700s wrote about fasting, that the best of all medicines is resting and fasting. And more recently in the US, Rouleau mentioned that reducing and restricting calorie could reduce glycosuria in diabetes. And also Jocelyn and Allen recommended that people with diabetes eat only a low calorie and near zero carbohydrate. Very difficult. So when we talk about intermittent fasting, we're talking about using it for health reasons such as weight loss or other reasons, such as some people in diabetes, they would like to use it. But we like to remind you there are many various types of this, and that's make it more complicated. So this diagram just showing us, if you look at A, B, C, D, this is an example of intermittent fasting. And also if you look down in E and F diagram there, you can see that this is what we call time-restricted feeding. And I will talk more about them in the second slide following. I would like to remind you that non-caloric fluid intake is permitted, and this is a differentiation, for example, from the religious fasting, such as our Muslim, religion fasting. And this is in more clear point here. What we're talking about intermittent fasting is, first one is ADF, alternate day fasting, where you have 1 day ad libitum feeding, you can eat whatever you want, and 1 day complete fasting, so it's alternate day fasting. The modified ADF is, the difference is that in that day you are not completely fasting, but you're taking 25% of the calorie, so it's a lower calorie. And the 2-5 is 2 days fasting per week and 5 days non-fasting. 1-6 is in a way similar, but different days. And the interesting one is what we call time-restricted feeding, which people are much interested in this one. And in this regard, you have each day you fast between 12 to 20 hours, and some of them use it as early and do it late, as we can see later on. So what are the benefits that people think from intermittent fasting? Now, the idea of knowing this idea about the benefit of fasting goes back to the 1940s, when scientists looked into the animals, and mainly mice. They looked into experiment in them that calorie restriction in the form of intermittent fasting appeared to extend the animal lives. And I'm just going to show you a brief, the only animal study in my presentation using mice, and that was published in 2018, using what we call fast mimicking diet. And we can see the study here. I'm sure you can see that FMD is fast mimicking diet. You can see the islets are much better than the one on the control in the upper side of the picture. And if you go to B, you can see FMD showing much more insulin there compared to one on top with the control, where there is less insulin in the islets. And if you go to the extreme of your right, the merged one, you can see it's much more, containing cells. And that's what we call fast mimicking diet in this study, restore the cells of pancreatic islets in the mice. Not only that, it also affected the microbiota. And you can see here, I'm sure probably some of us are familiar, and I personally learned that some of the microbiota are beneficial to us and some of them are not. And in this fasting method in the animals, they saw increase of the genera of Parabacteroides and Brochia, which are helpful and more healthier for us to have, and reduce of the harmful one. They mentioned below, they are difficult to say. I would not try to say them. Now, this slide coming from a publication in 2018 in Science, talking about the potential benefit of systemic effects of caloric restriction, or what we call intermittent fasting. It's a busy slide, but I would like to direct you to the blood, where you can see adiponectin, which is an important marker, increasing. And also importantly, on the liver, for example, you can see the insulin sensitivity improved. And also, if you look at the skeletal muscle, you would see that again, the insulin sensitivity improved. If you look at the brain, there is cognitive function improvement, stress resistance improve, oxidative stress improving, and cardiovascular benefit, as well as in adipose tissue, you can see again adiponectin production increase and improving of insulin sensitivity. This is a busy slide. I would not dare to talk to you about it, but I will just summarize it for you. This is from the New England Journal of Medicine, a very nice article published in December 2019 about intermittent fasting. What is showing here is the cellular changes that happen, but I don't want you to remember that. But all these changes happening are positively, and it's summarized here. Collectively, the organism responds to intermittent fasting by the following: minimizing anabolic process, favoring maintenance and repair, enhancing stress resistance, recycling damaged molecules, stimulating mitochondria biogenesis, and promoting cell survival. A few studies to talk about with intermittent fasting, starting with this small study in 11 overweight adults. They look into using them as a 4-day randomized and crossover study between early time restricted feeding compared to the one, as you can see in the diagram. I hope it's clear. The control were taking their food, the same calories divided into 3 times the regular time, while the early time restricted feeding are taking it in a short period between 8 a.m. and 8 p.m. And they studied these people and looked into one of the things here on the glucose level. You can see in the black dark color, the early time restricted feeding. You can see at the night time is much lower. And if you look at it in general, you can see that the early time restricted feeding improves the mean glucose, as you can see here, and also the glycemic excursion. Importantly as well, they looked into the gene expression in the whole blood, where they saw longevity genes are stimulated. In addition to that, they looked into the autophagy genes, and again, they saw that an example of that LC3A, I'm not familiar what it is, but apparently it's an important autophagy gene, and that was also stimulated with this early time restricted feeding. And concluding here that early TRF, going to call it briefly, improves 24-hour glucose level and may also increase autophagy and anti-aging effects in humans. Going back again to the ADA, American Diabetes Association, and looking into studies in diabetes and pre-diabetes, in the same report I discussed before, they have included patients' studies on diabetes and pre-diabetes, and they mentioned these 5 studies here, and they summarize their opinion about it, that studies 1 to 4, talking about type 2 diabetes, they were small and for short duration. And studies from 1 to 3 demonstrated that whatever you do in intermittent fasting or consecutive day restriction or fasting 16-hour result in weight loss, but there was no improvement in A1C in this regard. And study number 4 showed similar reduction in A1C, weight, and medication changes in doses when 2 days, so this is the 2-5 of severe energy restriction compared to chronic energy restriction. There's not much of a difference there. And study 5, I'm going to just show you some slides about it here. This is again of early time restricted feedings, and it was randomized the study, 6-hour feeding period. Again, you can see it's not different from the one before. It's for 5 weeks and there's crossover. And they studied these people. The result here showing that glucose, there were no significant changes between the early TRF compared to the control, but insulin level was reduced in people with early time restricted feeding. And that is also importantly shown here that beta cell responsiveness was improving significantly and insulin resistance was reduced significantly in early time restricted feeding. And they finalized about the opinion about the last study that I presented, that men with prediabetes and timing of the food, like 6 hours in this study, have shown improved insulin sensitivity, beta cell responsiveness, blood pressure, oxidative stress, I didn't show you all, and appetite as well. What about the recent studies? So that was in 2019. We have more studies coming. This is not a study, but as you can always expect, the New York Times always have something to say. And this is in February 17, 2020, where Jane Brody wrote about this article, The Benefits of Intermittent Fasting. And what she's saying here that I was skeptical, but it turns out that there is something to be said for a daily fast, preferably one lasting at least 16 hours. And in 2021, recently, again, last year, this is another study published that year, and this is from China actually, looking into 10-hour time-restricted feeding group, and they will look at them from 8 to 18. That's the time they were, eating only, and after that, no. And again, in a way, we'll compare them together, and that was somewhat positive study showing that HbA1c, and these people are type 2 diabetes, reduction in HbA1c, fasting glucose was reduced significantly, and the weight was reduced. A lot of markers studied in this, and they were mostly positively impacted by the study. I don't have time to go to all these details, but I would like to say that the 10-hour restricted, in the conclusion of this study, 10 hours restricted feeding improved blood glucose, insulin sensitivity, weight loss, enhances quality of life, cardiovascular benefit, and by reducing the atherosclerotic lipids profile. Another recent study published a few months ago in October 2021. This is called a randomized one-year trial. It's a little bit more patients here, participants, 50-50 divided men and women, 6 months of weight loss followed by 6 months of maintenance. And first 6 months were followed by dietitians, and the 6 months maintenance without face-to-face counseling. And you can see they use here 2 to 5, 2 days of restricted feeding, but here they use 400 calories for the days of fasting restriction in female and 600 calories for the male on 2 non-consecutive days. And here you can see the result of some of the results here. Change in weight was similar between the two groups, so both of them improved. Same thing with the changing in systolic blood pressure and changing in diastolic blood pressure. So just to mention here, I will not go into details, but in both groups there was 26 to 28% reduction in the energy taking, and the conclusion of this was both intermittent and continuous energy restriction, both of them resulted in similar weight loss, maintenance, and improvements of cardiovascular risk factor after 1 year. However, in this study, at least showing that feeling of hunger was more pronounced in the intermittent energy restriction. I'm going to end with a summary of these studies published recently, actually online, just 10 days ago. Sorry, this one. Yeah. 10 days ago, as you can see in Nature Reviews Endocrinology, and by a well-known author in the field, Varadi Krista, Looking into the summary of the human studies, according to the study here, looking into ADF, intermittent day fasting, 5-2 diet, and time-restricted feeding. And I don't think you're going to read anything here, but these are the group of studies that they look at, and I will give you the result later on. ADF and 5-2 diet in humans, and you can see the benefit on weight loss here was in the range about 4 to 8% from baseline over a short period of 8 to 12 weeks in these studies. This is the summary of the findings here. And also when they looked into time-restricted eating in humans, actually it was less of weight reduction. It was 3 to 4% reduction from baseline. So it is less than the ADF, alternate day fasting, and 5-2 diet. And there was no study to date showing that more than 5% reduction in from baseline with time-restricted eating. But these are all short. Now this slide, I don't think we need to go into details, but basically what is showing some of the summary of the studies that we talked about in this review, where energy intake was reduced by 10 to 30% in the studies. There is not much of a change except that, as we said earlier, the body weight, you can see the ADF and 5-2 are much better in a way compared to time-restricted eating. And more importantly, there are others you can see I did not highlight because some of them showing improvement, some of them neutral, but the one that's clear in most of the study that oxidative stress was reduced, and this is important. Now again, this is a summary of these studies. The key points on all this review: the three main forms of intermittent, alternate day fasting, 5-2, time-restricted, produce mild to moderate, as we said earlier, in all the group 3 to 8% in a short period. And the weight loss achieved with intermittent fasting was not much different from the traditional dieting we do with daily calorie restriction, which is usually, people say it's more difficult. The ability to have a longer effect is not yet well understood or done. Some of the studies that showed improvement in cardiometabolic, as I mentioned earlier, others did not show that. But in general, they were safe and produced very few gastrointestinal or other side effects. Now, I will leave you with the same actually review, the recent one with the current advices, indication and contraindication, who should not be doing intermittent fasting: children under the age of 12, adolescents who are normal weight, women pregnant, lactating, somebody with a history of eating disorder, below BMI below 18.5, and elderly above 70. Who can do intermittent? Almost all others. And talking about adolescent, we did not recommend there, but adolescent with severe obesity is recommended or can do intermittent fasting. Adults with normal weight, in addition to the overweight and obesity, can, hypertensive, dyslipidemic, insulin resistance, prediabetes, and diabetes, whether it's type 1 or type 2. Now, it's important to advise if somebody wants to do that, there should be an adjustment period, usually 1 to 2 weeks. And during that time, people need to be careful. They might have headaches, and these headaches apparently improve significantly by taking enough fluids and water. And exercise should not be changed from your program if somebody wants to do that, but after a while of being stable, then you can go back to your daily exercise. Fibers need to be sure that they are available in the diet, including fruits, vegetables, and whole grains, to increase the fibers so you don't have less fibers in the body. Protein needs to be given at least 50 grams of lean protein on the fast day on this ADF and 5-2, and also that will be helpful because some studies showed maybe some lean mass loss to prevent excessive lean mass loss. Beverages, for the people who take alcohol, take in moderation, and moderation of caffeinated beverages and calorie-free drinks are allowed in the fasting window in the TRF. You need to monitor the adverse reaction, especially in the first 3 months. Nutrition deficiency can happen, and you need to watch carefully the vitamin D, vitamin B12, and electrolytes in some patients. And medication is very important. You need to be careful about medication for diabetes, for example, or hypertension, dyslipidemia, because that might need to be modified accordingly, especially with a successful, for example, weight reduction. And if you want to have a longer success, a structural behavioral change program should be added, and that will help for a longer time of success. Now, some people would like to stop this intermittent fasting after they reach to their goals, and should be recommended to be transitioned to a weight maintenance rather than going back to the old way of eating with regular calorie intake and doing physical activity like that. An alternative way is to modify the version of intermittent fasting, as you can see here, for example, increasing the energy intake on the fast day, or increasing the window of where you can eat in time-restricted eating. And direction is important now for the future, because these are important things we need to think about it. Long term, we need more than a 1-year randomized control study with quality to look into the feasibility and long-term efficacy. That we don't have. Also, we need to look into different population groups, such as people with type 1 and type 2 and PCOS and thyroid disease. Also, we need to compare between these different types that we discussed earlier: alternate day fasting, 5-2 diet, and time-restricted eating, to see if there's any one of them is superior to the others. And also, we need to look into the benefit. Is it from the weight reduction happening, or by fasting itself we are getting the improvement in the metabolic markers? Now, I'm ending with this slide, mentioning that the one who wrote this nice review just recently, Krista Varady from University of Illinois, already doing this study. It's a longer study, as you can see, looking to see that more adherent with time-restricted. This one is time-restricted, is going to be a little bit on the late side. You can see here that they're looking for 303 arms, each arm having 108-hour time-restricted feeding compared with energy restriction continuous and the control. And you can see the time-restricted feeding is here going to be taking the food, in a different time. So it's like in the morning fasting actually, and they take the food afterwards. In a way, we call it late or modified. And with that, I would like to stop here and thank you very much for being with us and listening to my presentation.
Thank you, Prof, for your formative and interesting slides. Any question?